Hello, friends. We're just giving a very snippet on record maintenance. So this was a part of a larger talk that I gave in Chhatrapati Sambhaji Nagar on 13th April. So it was on a record maintenance. So I spoke about the, the key aspects of record maintenance, computerized physician's order entry, drug errors, MLC, and critical incident reporting system, so on and so forth. So it's just a snippet from that on the key nuance of record maintenance and its importance. So good for intensivists to have some clarity on what are the essential aspects of record maintenance that we need to bear in mind from the scientific point of view. So obviously, any record maintenance we speak on, we need to understand there is some sort of a flow or a process involved in the way that we function in ICU, which we call it as an ICU workflow process. So we need to be aware of the key aspects of the ICU workflow. So typically, we tend to see the patients during resuscitation and post-resuscitation and initial ICU plan. So we could broadly divide the care plan as supportive, treatment, and prevention, which intensivists are all involved in all these three dimensions of ICU workflow. When I say supportive, it's all about life-saving interventions that you would do, which pretty much is innate to our practice, which is airway, breathing, and circulation. So this, as an intensivist, we do this often. Why we talk about this? Because when you are documenting and maintaining a record, it should involve these tenets as to what are all the life-saving measures that has been put in place. And then we plan treatment based on the history and we need and the sort of a clinical examination that we perform and the investigative modalities that we adopt, construct differential diagnosis and do a diagnostic workup with investigations, imaging, and then stratify the patient, prioritize patient based on severity and plan treatment and prevention. This is a typical workflow that any intensivist would be doing day in and day out. So when you embark on doing good record maintenance, all these salient aspects has to be captured and put into the record as showcasing your means and ways of ICU workflow. And again, I just show this figure. I tell all my trainees our whole ICU TNET is basically constant integration in a very relentlessly continuous way of what we do as a clinical examination, guided by clinical history. And then the way ICU is different to clinical medicine is that we capture all the monitored variables and all the gadgets the patient is connected to, be it dialysis machine, be it ventilator, be it infusion pumps, be it ECMO, or be it any other plasma exchange, or any other machines that they're connected to. We have to integrate that in the clinical sort of a monitoring. And then we integrate all the lab parameters, ECGs, echocardiograms, any investigative modalities you would embark on, imaging and bloods. And we constantly keep integrating this and then plan our diagnosis and treatment. So this is what we keep doing it. And this is the daily functioning of an intensivist, that where we are constantly integrating the clinical, monitored, investigative modalities and keep formulating the plan and keep formulating the preventative aspects. And all this needs to be documented is what is the essence of record maintenance. And there are certain reasons as to why poor charting happens in ICU. What is the common reasons? It's fairly intuitive that you have a nurse-patient ratio which is deficient, and there is a frequent changes in the nursing ratio. All this leads to poor charting. And the typical ICU patient, friends, is like this: someone who is connected to monitor, infusion pumps, ventilators, so on and so forth. So the burden and the time constraint a nurse has in capturing all these variables is one of the reasons for poor record maintenance. Or there is a lot of, it's a busy patient, so a lot of things are happening. So a nurse gets terribly busy to chart each and every aspect of this. That's why there has to be some process of maintaining good record in this, and frequent interruptions that tend to happen in the care. And whilst you are doing record maintenance, all this can be reasons for poor charting because you are constantly in ICU work is quite like, well, ICU work is very fragmented. You cannot be fixated to something and go on to accomplish this task because in the process you would be constantly interrupted by various other things and overcrowding. So you get overtly busy, so your ability to record and do documentation gets affected. And if there is a huge inflow of patients or a lot of admissions tend to happen, so that also leads to poor charting. So these are some of the reasons that are cited in the scientific literature as to the causes of poor charting and poor documentation. So these are the reasons for the poor documentation. ICU is very busy. You have less nurse to patient ratio. Nurse is overworked, or if there's a very busy patient, a lot of things happening. You may need two nurses to document effectively, and you have more admissions. So all these are some of the reasons for poor charting. And there are ways how we can enhance EMR effective. What is EMR? Electronic medical records. So all we work in Manipal, and most hospitals now have electronic medical records. There is a means and ways that you need to adopt to increase your EMR effectiveness. That is, of course, emphasizing and educating our healthcare personnel on the importance of documentation of each and everything that is put in, that is being done to the patient. And the way we do it, okay, let me say how we do it in Manipal. Like I have, since the start of our hospital, we had created templates. So creating a templates, so I think you can ask any of my trainees, they all know we have templates for different counselings, we have templates for different procedures, we have templates for different sort of a clinical conditions. So of course, we use the template and then calibrate it to the given patient and try to tweak the notes. In that way, we don't miss out on certain salient aspects of care management plan that we would have for the patient. So having this template is already documented into scientific literature as a means and ways to do effective charting. And dictation in Manipal, I think we do have a dictation, so we can adopt this dictation because many a times we keep speaking and not necessarily it is easy to chart and document each and everything that we speak. So dictation, of course, as you keep speaking, it gets sort of translated into the Word document, and it gets translated into words and sentences, and it gets archived in the system. So dictation, all our systems are enabled with the dictation. So of course, many of our team members not necessarily use this as a means because I think templates is what they find it little more easier. But dictation is a way back, around 16 years back or 18 years back when I was in Australia, this dictation was a norm in all the OPD patients, and all the patient documentation used to happen with dictation. And even when you scribble, this is important. I think this seldom we do. I suggest and recommend that ICU's station should have a scanners, because even when we are explaining certain things to the patient by drawing certain pictures, or even when we scribble and write certain things to explain, this can be scanned and then archived into the system. So this is also recommended. So these are simplistic ways as to how we can put in processes in place to make sure that everything we are doing is documented, because everything becomes a legal document in the court of law. And these are the ones which protect us as to what we are doing for the patient. So I think scanning is something that maybe my good friends in intensive care can pay attention. We seldom do this because I know every day when I do rounds, I explain to the patients by drawing certain things and by writing certain, even those things can be scanned and archived into the system. So this is something that you can keep in mind. And what are the components of medical record? So this is important. See, whatever I'm talking is from the court of law, what is defined as medical record. So medical record in the sort of a literature or in the legal parlance, the front sheet, of course, now we have EMR. So the admission note becomes a legal document. Consent, any consent that you have taken becomes a legal document. And any letter that you give to the patient, they ask for, sir, we want a letter to show it to a different doctor. So any letter you give it to the patient, which they take it for a second opinion or even for the transfer of patient, become a legal document. And discharge summary is a very important legal document. So these are all, you have to pay attention, create templating so that all these are nicely formatted and there is no sort of a slip up in what you are, what you are writing it down or what you are articulating. There can be a lot of differences and that can be misinterpreted. So please make sure that some attention is paid and due diligence is done, that everything goes in a very seamless way. Admission notes are a legal document, and the clinical examination that you have performed and documented becomes a legal document. And all the investigations, which in our hospitals, everything is electronically available in the system that has been archived, that becomes a legal document. And even the nursing note becomes a legal document. And of course, the surgical notes, the type of surgery, the type of interventions that are done, which is archived and charted down, becomes a legal document. And most importantly, at the end of it, the treatment formulation that you have given becomes a legal document. Most importantly, each and everything has to be signed. So the signature, the digital signature that you put in place also becomes an important legal document. So in Manipal, all my trainees know the ICU chart that we write every day. We write certain orders, ICU plan. I tell all my trainees, and my signature or one of our colleagues' signature is mandatorily there, because if it is not signed, then it is not considered an authenticated document or a proof of evidence that you have written. So it has to be signed. Simple thing, very intuitive, very archaic, very germane, but it has to be mentioned. So signing is a very important. So these are the components of medical record that are identified as all legal document when the court asks for these documents. Why is medical records important? Is it important? Yes, it is very important. Most importantly, there are four, five, six, there are I think seven reasons why it is important. Any criminal case, you may be treating a patient who may be having a criminal, or he may have some criminal proceedings. So if there is anything of that nature, these medical records are solicited by the court of law, and you may have to submit, and it has to be foolproof, and all those components have to be entered into it. And workplace compensation, because you may have a trauma patient, you may have a person who has had an accident in the factory or a road traffic accident or a fall. So he or she has to claim for compensation, and for adequate compensation, how effectively the notes have been documented goes a long way in getting a good sort of a workplace compensation. And for insurance, I'm sure each of you are expert, you know how challenging it is to get a good insurance claim, and good documentation is what that is needed. And malpractice and medical malpractice, if you are alleged of medical malpractice, and the only defense that you have, only defense is what you have documented. You may have done everything that is at your disposal to save a life of a patient, but if that has not been documented, there is a huge gap as to how the court looks at it as whether you have done or not. So it's a simple documentation that makes a difference between all the good efforts that you have put in as being equated to nothing being done. So it is as simple as that. So to protect yourself, to defend yourself, the only thing that you have at your disposal is your medical records and your documentation. So can't emphasize more on that. And will, if an elderly man is dying or death or whatever, even for the purpose of will, the medical records become important. And personal injury, of course, we know if there is an injury of any nature and we want to try to claim compensation from anyone, I think this is important. And what are the legal aspects of medical record? Because the court and police can summon the medical record at any point of time where there is a MLC registered. And this is important. So the limitation period determined by our National Medical Commission or by the legal jurisprudence is that you have to archive every notes for 2 years. But if it is for consumer protection, it is for 3 years. So just make it simple. For all medical records has to be archived for minimum of 3 years. But if there is an MLC, until the case is disposed, you have to archive and store the record. So this is very important. So 3 years is what you have to remember. So Consumer Protection Act that came in 1986 and amended in 1993, and even now, so we have BNS. So Bharat Nyay Samiti. So this also puts doctors under consumer protection, which is not a good thing. So if you are proven to be medically negligent, you can be imprisoned for 2 years. So it's a very bad sort of a situation that we are in. So medical fraternity is not protected. So we can be put in jail if a medical negligence is proven against you. And the only defense that we have at this point of time is a good documentation. So the 1993 Consumer Protection Act and even this Bharatiya Nyaya Samiti that is come puts doctors under Consumer Protection Act, and you can be alleged and you can be put into litigation, and big claim can be asked, and even to an extent of being put in jail. So be guarded, friends, on the medico-legal sort of a nuance that we are all, we could be troubled with. So documentation is your only defense. And Consumer Protection Act really emphasizes on the importance of record, really emphasizes on the importance of the record, and it also suggests that the record is most valuable, and proper maintenance of case sheets is terribly important, especially when you're dealing with a medical legal case. And the proper maintenance of case sheets can be alibi for the patients, and all your case records, all the documentation that you have done as a medical record is a legal document. So it can be used in the court of law for saving you or for going against you or for litigating against you. So this is something which you have to bear. So whatever you put in the system in writing all becomes a legal document. So what does Medical Council of India Regulation 2022 put in as a guidelines on maintaining medical records? So it just puts in certain clause as to what are the key aspects. So as I said, the Medical Council of India, National Medical Commission suggests all records to be archived for 3 years, and that comes under section 1.3.1. And submission of these records should happen within 72 hours when the court of law asks for the record. The records have to be submitted within 72 hours. This is all as per the National Medical Commission, that is section 1.3.2. And Medical Council of India suggests that there has to be a register that should be maintained with all the certificates which list down the patient's ID and signatures. So that is section 1.3.3. So certificates of any certificate, death certificate or any certificates that we issue to the patient with patient ID and a doctor's signature has to be archived, and a register has to be maintained in the hospital, 1.3.1. And in fact, Medical Council of India and NMC suggests and encourages the hospital to go EMR, to go electronic, because the archival and retrieval of data is much easier with electronic. So I'm sure most of the listeners, most of my intensive care friends, you would be working in a hospital setting where you already would have EMR. If you are not having, you should go in that direction, because that is the sort of a direction given by NMC. This is to facilitate quick retrieval of records, and this is section 1.3.4. And of course, any hospital dealing with MLC cases should maintain MLC register, and it has to be maintained until final disposal of cases. You cannot discard any of these documentation. So that's about it, folks. So that's a brief sort of a snippet on the key nuances of maintaining medical records. What are the key components of medical record? And the summary message for you is medical record is a legal document, and that is the only defense for you when you are litigated by the patient or by anyone. There's nothing that comes to save you. It is only what you have documented. Please remember, we all come under the ambit of Consumer Protection Act as per Bharatiya Nyaya Samiti, which is a very bad thing. And even to a point that doctors can be imprisoned if a medical negligence is proven, which is one of the hopeless things that India can have in the world. So I'm quite open to tell this, because no other country possibly has this sort of a thing where a doctor is put into the jail. So which is to be admonished. I think I can even go to an extent saying this has to be really scrapped and this has to be admonished. So thank you, friends. So request you all to submit your valuable work to Journal of Acute Care, and of course you can visit my website to read to this. Thank you. Thank you.